relationship between the diabetes and the liver disorders. So there was an article in Liberate stating that if you have diabetes, it may be a good idea to get your liver condition examined. This is because studies show people suffering with type 2 diabetes with a higher body mass index, meaning type 2 diabetes people with obesity are highly likely to have liver fibrosis, a condition that can lead to cirrhosis of the liver and later liver failure. So in the last class also, Guraja sir touched regarding the fatty liver condition and how grade 1 is not really that much important clinically and whatnot. So Dr. Anup Mishra, chairman of Fortis CDoc hospital, said they recently conducted liver ultrasonography and fibroscan tests to assess fatty liver and fibrosis in 250 diabetic people, and they found that 85% of the patients had grade 3 hepatic steatosis, meaning fat cells comprise more than 66% of their liver's overall weight. So it appears to be a growing menace. So my question to Dr. Guraja sir is that how to decipher this in the clinics. It's very common in India and also in all countries that having diabetic cases has become very common, especially diabetes with obesity. They almost go hand in hand, and now we also are asked to take care of the liver profile. So how to go about this procedure, sir?
So definitely, if you observe what the acharyas have said very clearly, prameha itself is a disease which is kept under Astamahagada by most of the acharyas. If you observe the dosha, dusha, and all those things, it involves the multi-system. The dusha in prameha, according to Ayurveda, it contains even rasa, rakta, mamsa, meda, majja, vasa, lasika, everything it covers. So when such a disease which is covering entire shrotasas and different type of tissues, definitely it has its own effect. But regarding this new area, they have identified that there is some correlation between diabetic patient and the liver disorders. That may be, but it is whether it is due to the diabetes itself, that may be a chance, or whether the study has been conducted in such a patients, those who are diabetic since last 5 years. So they're already taking certain one or the other oral hypoglycemic agents, a chemical drug. Even that drug may be causing problem to the liver. So that may not be ruled out. So we need to understand all those aspects. But in Ayurveda, very clearly it is said, prameha or the diabetes, it is a type of disease more in favor of santarpanotta. So which is over nutritious, or maybe because of we are pushing the system into such a way that it has to handle with a lot of energies. When we are unable to maintain that, definitely the things will go in a wrong way. If you observe the pathology or samprapti of prameha, very clearly there is a mismatch with the agni as well as inside the nutritional material. So in such a manner, definitely we know that everything whatever we consume, it has to be metabolized and it has to be made homogeneous with the body at the level of liver. So when liver takes an important role, and this is an endocrine linked disorder, the multi-system involvement and multi-tissues involved, definitely there will be a lot of stress on the various tissues. All these things ultimately put a back pressure on liver, and liver ultimately ends up with some wrong deeds. That's the reason, because there is a lot change in our food style, there is a lot of changes in our lifestyle, there is a lot of changes in cases of our physical activity. So all these are progressive in such a manner that most of the people living in urban areas, they are turning to become the type 2 diabetic patients because of various reasons. So it's a multifactorial. So in such a scenario, definitely when system is being added or dumped with a lot of energy, it has to be metabolized by the liver, and liver is at stake. So automatically liver takes the wrath. So because of that, the liver ends up in trouble. So that may be a coincidental identification, they are understood. But here once again, along with the disease nature as well as maybe the management part of it, what the chemical drugs or synthetic drugs they are taking, that too also may be contributing certain factors to develop the fibrosis in liver. So we need to understand this part also.
Ayurvedic Samprapti of Pramehas, Master Madhava has clearly said, Medascha Mamsascha Sharirajam Cha Kledam Kafo Bastigata Pradushya. It is explained. Diabetes, obesity, and even the fatty liver disorders, all are related with the number one dhatu that is explained in the shloka itself, the Vedas, Meda dhatu. Under which circumstances you would, suppose a patient with diabetes with higher BMI comes, under which circumstances you would go for examining the liver or ordering a liver function test, sir?
See, examining the liver function test is not a mandatory one when a patient comes with a type 2 diabetes and is obese. So, in that situation, most of the times what we go for is a lipid profile examination, supporting thing. Then, many a times we have come across those who are obese may not be having a bad lipid profile. Whereas a lean person coming with a very bad lipid profile and the bad cholesterol is very high. So that doesn't make any sense of understanding the things. But obesity in the total body bulk of fat, if it is more, then definitely it is nothing but what he has consumed through the mouth. So it has the energy to reach it to the body through mouth only. So in order to overcome that, we need to understand that something to be done for the related with the intake. That's what the Ayurveda Nidhana very clearly says. Asya Sukham. That is the first line. What he says is Asya Sukham. The whatever the way we like to eat and whatever the quantity we like to eat, we consumed it. So ultimately, it has ended, and it is not a sudden one day happened thing. It is a continuously happening process, and we ignored it in the beginning. So ultimately, the person lands up in a big disease. So we need to understand that.
It is very important to know that sometimes a lean person can also have a fatty liver disorder. I mean, suppose if you have diabetic person with obesity and liver complications, or diabetes with liver complications, how to plan a treatment there? Can there be common herbs or medicines and panchakarma that we can choose which target the diabetes and the liver conditions as well?
Definitely. First of all, if it is a diabetic, many times may not be a suitable candidate for panchakarma type of thing. But provided if we analyze the patient and his body mass index is supportive, and there is, if you consider this condition as bahudoshaja, then we can go for the virechana type of things, which virechana which supports the liver functions, as well as it also helps to revive the liver conditions, and even also it helps to remove the toxic materials from the gut. So it entirely supports all the three doshas, and definitely with the predominancy with the pitta. So when Agni is maintained with these type of activities, definitely it is going to help the obesity as well as diabetic condition plus liver disorders. And we have a lot of common drugs like Katuki and Haridra and even Nishamalaki, all these type of things. There's not only Guduchi, they not only support the diabetic component or the part, it also supports or clarifies or rectifies even the liver functions. So definitely even Kalamega, Kiratikta, these are all the drugs which have much importance. So it not only clears the liver functions, it also helps in overcoming the sugar values. So definitely these are some of the drugs which can be taken care or utilized in both the conditions of obesity as well as any liver disorders associated with diabetes.
In a known case of fatty liver changes, maybe of grade 3 or more, how long Ayurveda treatment usually is required so that liver starts functioning normally and gets rid of the fatty deposits, sir?
Usually, if a grade 3 fatty liver or something like that, which is once beyond the first stage, which requires a treatment protocol, it depends. If you suggest the patient to go for the virechana and do the procedures, then the results may be within 1 month. So if it is right away only Shamana Chikitsa because the patient body mass index is not supporting or some other factors you are feeling that is ayogya or person not fit for the virechana, then you can go for the Shamana Chikitsa, that is a palliative treatment. So in the palliative treatment, if continuously it is done, then it may take up to 60 days to 90 days to rectify.
If you are to go for Virechana out of the Ruksha Virechana, Snigdha Virechana, probably the Ruksha Virechana makes sense because the Snigdhata is already increased due to the Medha Dhatu there.
No, there is no hard and fast rule, but it is a Santarpana Vyadhi, Santarpana Utta Vyadhi, that is because of the extra nutrition. But we need to take concern in such a way that sometimes a patient may be even Sukumara, even though he is obese and all those things. We cannot go with a harsh way of purgation. We cannot go for the Tikshna Virechana. So we can go for the regular type of simple Haritaki Churna with water, something like that. If it is a non-diabetic, then with Guda. So such combinations can be made. Only with Jayapala and such type of drugs can be taken based on the requirement. If too much of obesity is there and patient can withstand and the manobhala is also good, then we can go for the Tivra Virechikas or Tikshna Virechikas like Jayapala and such drugs.